The next type of rate that we'll be covering is the hospital autopsy rates. These rates are covered in your textbook on page 560 to 564. The first thing that you need to be familiar with when thinking about these rates is the definition of an autopsy. And most of us are a little bit familiar with this process, whether it's from television or experience in the workplace if you work in the healthcare field. But the definition of an autopsy is examination of a dead body to determine the cause of death. Now, there are two different types of autopsies that you need to be able to distinguish between when you're calculating these rates. There are hospital inpatient autopsies and hospital autopsies. And the main difference in these is that for the hospital inpatient autopsy, the patient who is deceased actually was an inpatient at the time of their death, and their autopsy is then conducted or performed by either a pathologist or an MD, whoever has been designated to do that on the medical staff. For a hospital autopsy, the patient has been an inpatient at the hospital in the past, but was not an inpatient at the time of death. But the hospital staff who conducts autopsies will still be completing their exam. So just keep those two definitions in mind. Another thing to remember with autopsy rates is that newborns are counted along with adults and children. We're going to cover, again, just like when we were doing death rates, we're going to cover 5 different types of autopsy rates, and you can see those listed on your screen. The gross autopsy rate, net autopsy rate, hospital autopsy rate, newborn, and fetal autopsy rates. So we'll be going through 5 of these. Gross autopsy rates are a proportion or percentage of deaths that are then followed by an autopsy. So how many out of all the deaths at a facility, how many are followed up with an autopsy? Again, newborns and adults are counted together. So the formula for gross autopsy rate is the total number of autopsies on inpatient deaths for a given period divided by the total number of inpatient deaths for the same period, then multiplied by 100. So your bottom number, your denominator, would be how many inpatients died during a certain time frame, and then your numerator would be, out of those deaths, how many had autopsies conducted. Next is our net autopsy rate, and this is also a proportion. We talked about in the previous module that the net death rate was very similar to the gross rate, but that you used your net to scoop a specific population out of the denominator. Same approach for this. The net autopsy rate is adjusted. Bodies that have been removed from the facility, either by the coroner or the medical examiner, are excluded from the denominator. So your formula would be the total number of autopsies on inpatient deaths for a specific time frame or period divided by the total number of inpatient deaths minus the bodies that were unautopsied, so those that were pulled out by the coroner or the medical examiner. Okay, the hospital autopsy rate. This is another adjusted rate. It includes the autopsies on bodies of inpatients who died in the hospital, except those that were removed by the ME or the coroner, and bodies of patients who died elsewhere but who are autopsied by the hospital pathologist or MD. So if you'll remember those two definitions that we talked about earlier in the presentation. So our formula for this would be the total number of autopsies conducted by the hospital for a given period divided by the total number of hospital patients whose bodies are available for hospital autopsy for the same time frame. And again, that doesn't mean they had to be an inpatient at the time of death. It means that they had been a hospital inpatient at some point in the past, and their body was being sent for autopsy to the hospital by to be conducted by the hospital pathologist or MD. Okay, newborn autopsy rates. These may be requested as a separate number, and if they are, the formula is a fairly simple one. It's the total number of autopsies that were conducted on newborn deaths for a given period divided by the total number of newborn deaths for the same period, and then multiplied by 100. Fetal autopsy rates. Fetal autopsies are helpful to both clinicians and to parents or family members. It helps the clinician to determine cause of death and know if there was something that could have been corrected or some sort of area that could be improved on, and then it can be very useful information for parents because it can tell parents do they possibly have a genetic condition that they were unaware of, and maybe give them some good tools for making decisions in the future. The rate for calculating fetal autopsies is the total number of autopsies that are done on intermediate and late fetal deaths for a given period, divided by the total number of intermediate and late fetal deaths for that same time frame. And you'll need to review in your textbook or on the previous tutorial how you differentiate between intermediate and late fetal deaths. Okay, and again, just like on our last tutorial, there is a table that summarizes this information on page 564 in your book. It's table 10.17. It lists each rate and then tells you what the numerator and the denominator should be. Please let me know if you have any questions, and go ahead and get yourself some practice with these rates by completing the Check Your Understanding on page 564.